No more of this. I've had it with this residency. This is the last straw.
Hey, you need to get a grip. We both need to get a grip.
If I don't get out of this miserable, this ageist, this... Ugh. Okay, so what's bugging you?
Hey, what's the problem?
I just had another run-in with the head nurse at 3 East. If she makes one more derogatory comment about residents, I'm gonna scream.
Just quit whining.
You're exhausted. I can see it. If you weren't so tired, you wouldn't be so thin-skinned.
Yeah. God, my stomach's killing me. And I'm tired, and hungry, and poor. But not narcissistic. I'm not totally fixated on my own problems. What's going on with you?
It's my dad. I went to pick him up from the nursing home on Saturday. He was going to spend the weekend with me.
Look, you people need to learn to balance the professional with the personal. This doesn't sound to me like you're doing much of a job of either.
I don't want to talk anymore. I'm exhausted, too.
Well, welcome to the wonderful world of medicine. We're all work and no pay and no say. Make Jack and Jill nervous and irritable, not to mention tense and angry. The answer to everything is bite the bullet.
Both of you'd better learn to deal with it and get back to work. Nothing here that a little time won't fix.
I gotta talk to my program director. As far as I'm concerned, the medical system's about life support. It's time for me to pull the plug. I'll catch you later.
Hey, hang in there. The hours I work, they seem endless. And I never know if I'm doing anything right. I can't even catch up on the medical literature. And will these people ever stop writing? And then there's the contradictory directives. One attending tells me to do something one way, then another the opposite. It leaves me confused. Will I ever just get it right? And do you know what else? I have no life.
When I feel I'm being mistreated, belittled, and verbally attacked, and then I see faculty having the life I'm trying so hard to have, really makes me question where I'm going.
The attending last night, Dr. Enslow, told me I didn't respect him. So I tried to set things right. He told me not to answer back and to remember who gives me my reference. And all this in front of a patient. But you know what's really bad? Enslow hates what he does. He's miserable. So, what if I go through all this, put up with all this misery, and end up just like him? Man, I feel like I'm between a rock and a hard place. Between me and my wife, we already have over $100,000 in loans. We overextended to buy a house. We have a disposable income of $150 to $200. Doesn't leave room for any kind of life.
I went to talk to my advisor and explained how I'd gone to visit my dad in the nursing home. I was going to take him home for a weekend visit. What a warehouse. It stunk. Urine, feces. The smell was overpowering. My dad was a decorated vet. He served his country well and honorably. And then he had a stroke. And this is how he gets treated by the medical profession. Put in diapers, left to lie in bed, smelling like an outhouse. I told her I didn't want any part of a profession that treated people like that. I was so furious. I was so furious. He died in the car on the way to my house. I told her I wanted to quit. I told her I wanted out. She really knew how to push my buttons. Nobody in my family ran from anything. I wasn't going to be the first. I couldn't live with that.
I just had another run-in with the head nurse at 3 East. If she makes one more derogatory comment about residents, I'm gonna scream.
You sound pretty dejected, Ed.
You're exhausted. I can see it. If you weren't so tired, you wouldn't be so thin-skinned.
Yeah. God, my stomach's killing me. And I'm tired, and hungry, and poor. But not narcissistic. I'm not totally fixated on my own problems. What's going on with you?
It's my dad. I went to pick him up from the nursing home on Saturday. He was going to spend the weekend with me.
Why don't you two come in here? Sit down for a few minutes. Okay, so I understand that you're both dealing with things that are pretty normal for residents, but let's talk about them before they get the best of you. I've seen and heard you two talking about these things before. Have you spoken to anybody professionally about how you're really feeling? Joan, have you seen your advisor?
Not yet.
Look, I just finished meeting with your program director, so I know she's in her office. Why don't you go down right now and have a chat? This is important. You two should talk. Tell her what's bothering you and get some input from someone who knows you.
Yeah, sure.
Oh, and Joan, I'd like you to let me know how your conversation goes. See me at the end of the day, okay? I don't need the details. I just want to make sure you two have connected and you have a plan.
Thanks.
Okay, Ed, let's figure out what's going on and then decide on a course of action.
Early identification of a career crisis in the making is essential. But one has to wonder if the problems that produce burnout and lead to such extreme dissatisfaction with the profession might not have been prevented in the first place before it reaches the end stage.
We know that overall, about 80% of physicians are satisfied with their choice of a career in medicine. However, about 20% experience either severe doubts about practicing medicine or have critical reservations about their chosen specialty. We know that overall, about 80% of physicians are satisfied with their choice of a career in medicine. However, about 20% experience either severe doubts about practicing medicine or have critical reservations about their chosen specialty.
In my experience, the factors that lead to career crisis arise from a contradiction between appearance and reality, expectation and actuality. And it is this, I think, that leads to unhappiness, dissatisfaction, and eventually burnout. How does this come about? First, many residents select a specialty in medicine because they think it will give them independence of action with respect to treatment approaches and allow them to have input into treatment decisions that affect patients. Because of that, they can take pride in both their professional growth and personal contribution. In this context, we need to remember that a passion, and I repeat, a passion for medicine is often driven by a tremendous altruism, the desire to impact and to make a real difference in a patient's life.
Residents, especially first-year residents, have very little authority or autonomy, but they have tremendous responsibility, a burden they never experienced as medical students, and it grows heavier with each program year. Heavy responsibility, combined with little control, and long, arduous hours, even with the reduction in duty hours, that leave little or no time for personal life. Well, you have a recipe for burnout and career misgivings. Residents often worry about these feelings. Are they a normal part of their training? Or do they indicate more significant or substantial career misgivings?
So how can programs respond? In our program on stress, we discuss the importance of a good orientation, the importance of connecting residents to one another, and the community, of teaching coping skills, negotiation techniques, and, yes, conflict resolution. For starters, we can apply all of these to burnout.
Second, we can do a better job with mentoring by perhaps pairing a happy alumni of our residency program or a colleague in the community to help the resident learn what the real world is like. In other words, what professional life is like once residency training has ended.
There are other issues involved too. We all take professional satisfaction, which is crucial, for granted. We expect it. Some of the main sources of satisfaction residents derive come from relationships with their colleagues and other healthcare professionals. Unfortunately, these relationships are not always positive. Many report a lack of respect. This can be disheartening, even to the most impervious.
Mistreatment, verbal attacks, being belittled, and threatened about their careers also contribute to dissatisfaction and demoralization.
Programs must have clear policies that protect residents from any kind of harassment by senior residents and faculty. It is simply unacceptable. All evaluation systems should ask about feedback and if it is provided in a constructive manner. The policies should outline specific consequences for those who are unprofessional in their conduct and who make unhelpful and derogatory remarks to the trainees. These policies must be enforced. As you might guess, there's a lot going on with these two residents. At first glance, this situation might not appear terribly important, but faculty and program directors and even other residents should take these types of comments seriously, especially if the doctors making them do so on a routine basis. Comments like these are rarely made lightly. On the other hand, it's important not to overanalyze. Sarcasm and humor, that is appropriate humor, are important coping skills. What needs to be identified is the pattern of behavior itself. Habitual outbursts of unhappiness and discontent. These can easily be missed because of frequent faculty rotations.
Residents also worry about their finances, and with good reason. Many graduate from medical school with an average debt of around $110,000. At this point in their lives, many are also taking on marriage, family, car payments, and home mortgages. In a climate of decline in physician earnings overall, of having to work harder for much less, they worry about their future financial security. Residents may benefit from access to a financial planner. They certainly will be among the top wage earners in the country, but most usually start with a large debt load, and they often don't want to put off the purchase of a nice car, a nice house. If married, with children, they may have other costs associated with daycare and education. Some residents need help learning how to draw up and live within a budget, how to prioritize, and how to reasonably delay some gratification, rather than increase the strain which comes with increased indebtedness. Information about how to manage loans and loan repayment may also be helpful.
Remember, too, that the educational experience is critical to resident satisfaction. Time and time again, this comes up in surveys. But the learning experience is critically affected by the training experience. And this all ties in with the way they feel or are treated, or unfortunately, mistreated. We know that we cannot eliminate all the discomforts associated with a residency training program, but a conscious effort at reducing a resident's sense of mistreatment should enhance their experience greatly. In addition to all these strains, some residents are highly vulnerable because of their idealism. It's important to listen carefully to them, to respond most effectively. This will not be accomplished in one short meeting. Before the resident leaves the room, set up another meeting. Give them a specific appointment. Additionally, enact policies that will reduce their sense of mistreatment and make them feel part of the system, not just a cog in its wheel. Medicine offers a lot of potential careers. Any one of them is sure to be rewarding. It is our job to provide our residents with opportunities to figure out which one is the correct one for them. It is obvious that the attendant failed to recognize the seriousness of that interaction and therefore missed an opportunity to exert a little damage control. Let's back up and see how the incident might have been handled more productively. Both these residents manifest symptoms of burnout, which frequently begins under stressful conditions and might be interpreted as a career crisis. Burnout is defined as a syndrome that combines emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment or effectiveness. It can lead to depression and substance abuse, two outcomes that, along with stress, are covered in another segment of the LIFE program. A career crisis can take the form of doubt about specialty choice, or even an aversion to continuing the practice of medicine. After reviewing this program, you should be able to understand, identify, and manage symptoms of burnout and career crisis. You should also be able to list the life challenges residents face that may contribute to a crisis, as well as to describe counseling strategies that may be of help.